No, you're fine. I was laughing. I said, oh, she's not coming. He's like, yeah. They go, oh, I beat her.
It's a rare. Well, actually, sometimes.
It's been a rarity. I've been late. It's just how it is. You try to you walk in. I try to explain to Alyssa all the time. You walk into the office and she gets sidetracked or
I
someone
know.
grabs you, and I'm like, wait, I gotta go. I'm late. We set? All right. Everyone set back there? All right, sounds good. So, good morning, everyone. Today's 267 days later. It's 30 weeks since we started our first COVID-19 case. So, we're entering our 39th week. So, it's, we're there. It's going to get tougher. The numbers are going to get tougher. But we can get through this because we are New York tough. But, unfortunately, I have to start today's briefing by reporting one new death in Albany County last night. A 70-year-old woman in her 70s who was a resident of a nursing home who passed away. So my condolences and prayers go out to the family and to all the families and to the other 166 family members. Again, you're in our thoughts. It's a difficult time that you're going through, and it's a difficult time for anyone to lose somebody, but especially to this awful COVID-19. So please, we're there for you if you need us. We're now averaging more than 2 deaths per day during the month of December. As of today, there's now been 6,333 positive cases of coronavirus in Albany County. 2,218 people are currently under mandatory quarantine. Today's increase is 185 positive cases overnight. This is the highest single day we've seen since the last highest day of 167 new positive cases on December 2nd. It's what Dr. Whalen and I have talked about, have said, get ready, the numbers are going to get high, and we know 100 is going to probably be the norm for a while. I'm just hoping not to break the 200. But out of the 185 new positive cases overnight, 19 had close contact to a positive case, 29 were healthcare workers, and 137 don't have a clear source of infection. As of today, 24,955 people have now completed quarantine. Of those, 341 tested positive for the virus and have recovered. 91 recoveries since yesterday. There are a number of residents currently in the hospital because the virus has once again gone above yesterday's record. There are now 96 people currently hospitalized with the virus. Our last record was yesterday at 90. There were 13 new hospitalizations overnight. We are now averaging 12 new hospitalizations a day this month. We continue to see this virus putting people in the hospital with a wide range of ages. So I want to point out 2 people are younger than 25, so it is starting to affect that age group differently. That's one up from yesterday. 14 of those hospitalized are between the ages of 25 and 49 years old, and 38 are between 50 and 74 years old. Our hospitalization rate is at 1.51%. Of those who have tested positive yesterday, that rate was 1.46%. 16 patients currently in the ICU. Yesterday, the number was 14. This is the highest number of ICUs that we've had since April 13th. We tied the highest day we've had for ICU patients. So just to let you know, our hospitalizations and now our ICUs are a lot higher than today than it was when we started this 9 months ago. It's true our hospitals are better equipped to deal with this. It's true there's new therapies out there. There's new vaccine coming out. But for whatever reason, we're starting to see more hospitals filling up and more ICU beds. People are staying shorter, they're getting out, which is a good thing. St. Peter's is reporting record numbers of patients in their hospitals, and we need to bring these numbers down. Because as we stated the other day with the control room, and we have a control room meeting today, that basically they're basing the new matrix on whether or not hospitalizations beds, ICU beds, and personnel at these hospitals where we go. Over the last 5 days, we've averaged 150.6 new positive cases a day. Yesterday it was 131.6. Looking at our percent positive rate, Albany County 7-day rolling average now hits 4.8% using the data from December 1st. The latest available on the state dashboard. Our daily percent positive rate hit 4.2% on Tuesday. I'm hoping we'll get a little bit more information today with the control room meeting, like I was just saying, and to get the answers for the microcluster new initiatives that the governor put out, and what that means to businesses, what it means, what zones we go into, and so forth. So we have that today at 1400 hours, and once we get that information, we will get it out. Other matrix will include hospitalizations, health rates, hospitals, beds, which is staff, and so forth. And again, it's going to be dependent on what they're building off of, and then we'll figure it out. I wish I had the better answer. I wish I could do a deeper dive into this, but until we get the answers or we hear from the governor's press conference today, we're still waiting on guidance from DOH on how we're going to go forward. So the best thing we can do, not to go into the microcluster zone, which we're getting very close Saturday and Sunday, depending on the new guidance, is basically stop large gatherings, stop going out if you don't have to, stay at home. Same thing that Liza and I have said 1,000 times. Socially distance, and please wear your mask properly, cough into your arm, wash your hands, and stay 6 feet apart. And don't go into establishments that aren't doing the right thing, or if there's someone walking around not doing the right thing. Listen, people are on edge. You don't have, you can kindly tell them to pull their mask up over their nose, but if they give you an attitude, walk away. It's not worth it. It's not worth the aggravation. You can just try to educate people, but we need people to educate themselves and do the right thing. So the biggest thing that Dr. Whalen and I have tried to do since the beginning is making testing more available for people, especially in neighborhoods that this has affected more and more. So we continue to evolve and get more testing. Yes, more people are getting testing, but we still need more testing sites. We need still to get everyone tested that we can, whether you have signs or symptoms. This is really going to give us the data that we need of how much more this virus is in our community and how it's spreading. It helps Dr. Whalen and her team do their job. Today is the first day of testing at the Times Union Center, and we'll continue on Mondays and Fridays going forward. And today we actually got a full list of people, so it's packed today, which is good. And it makes sense with the colder weather to get people out of the elements and socially distance. Obviously, it's a 17,000 seat arena, so there's plenty of space to socially distance everyone and do this safely. And that's the key word, safely. But inconvenient, to make it convenient for people to come and get tested. And again, I will challenge any organization out there, any group, any nonprofit group, if you want us to help set up testing or for your community members, we'll make it happen. We'll make it happen. I need partners in the community. I need people to help us. And I need to educate people why they need to come out and get tested. And also at the Times Union Center, parking will be available for free, so please keep that in mind. Also next week, we are going to the Watervliet Dome on Wednesday. So thank you to Mayor Patricelli and the council members there and everyone there, and our great partnership we've had at the Watervliet Dome with Doss and everyone else. So we will be testing there on Wednesday. So we are trying to get out in a partnership with Sheriff Apple. We're moving to the hill towns to get more testing up there in the hill towns available for Burn Knox, Westerlo, and Queens, which we have gone down, and to the supervisor down there, thank you for everything, because he stays on top of us. So we do need these partners, and the only way we're going to curb this is get people tested. But Dr. Whalen.
Good morning. So again today we find ourselves in the unfortunate position of breaking another record, and we are not alone in this. This is happening across the country. There is a surge in illness, in hospitalization, and in deaths. This is reason more than ever for people to comply with the advice that we've been giving for the past 8 months. We know that we're a week out from Thanksgiving, a week and a day out from Thanksgiving, and we're starting to see cases pick up. I do not think yet that we have seen the full extent of the effect of Thanksgiving, And I am concerned, as are national officials, of a so-called surge upon a surge. It is likely that our numbers will continue to go up. It is likely that they will be higher due to the Thanksgiving travel and gatherings. And it is likely that it will not be improbable that next week our numbers will be in the 200s. What we are doing today will influence the numbers in the next 2 weeks. So again, coming into Christmas time, coming into Christmas season, it is important for people to curb what they normally do. Curb, shopping in crowded places. Try to utilize online platforms, and I'm happy to see that a lot of our local retailers are making this option or curbside pickup available for people so that they can avoid crowds, shop at off hours. Do what you can to protect yourself from being exposed to a large amount of people, and when you are out and about, it is essential to wear a mask that covers your nose and face, and that you remain as distant as possible from other individuals and wash your hands. In the coming days and weeks, what we're concerned about, again, is the surge of hospital beds. And every day we are not happy to have to report increases in hospitalizations, increases in ICUs, hospitalizations, and unfortunately, deaths. Many of these, please remind yourself, are preventable with your behavior changes. If you do what you can to stay safe, you can make an effect in the general community. Each one of us has this responsibility. And, again, we continue to implore you to do the right thing.
Thank you, Dr. Whalen, and thank you for your resilience of getting us through this. And, as we talk about everyone, not just the essential employees, but everyone out there doing their job, thank you. And I do try to highlight people, but I do want to thank Major General Shields in the New York Army National Guard. The National Guard, if you look at it this way, in this nation's history, has not been this deployed since World War II. And not just delivering food packages, getting ready to hand out the vaccine, standing at airports all around the state of New York, and still being mobilized overseas, which my buddy comes home today, so I will be there to see him at the airport. There's more demand on not just the National Guard, but a lot of agencies throughout the state of New York and throughout this country that are at max. And the only way we can help them is by rolling up our sleeves and doing the right thing, and staying home and not going out and wearing the mask and self-quarantine to the best of your ability, and stay away from people, because it is going to be a rough next 2 months. And CDC has spelled it out for us, and I don't want people to get to the point of COVID fatigue like what has happened, but most importantly with this vaccine coming out, thinking that we got the magic cure and it's all going to go away by January 1st. That's not the facts, people. It's not. You can wish you're going to go to Disney World, but it's not going to go away. The vaccine is not going to take care of this. It's going to, and I hate to say it, and again, I hope you can, another issue that you can poke fun at me if I'm wrong. I hope I'm wrong, but we're looking probably to September 2021 before you get anything normal back in your life. And we still got to deal with the economy crisis, people losing their jobs, the businesses that were shut down, the businesses that are going to close, that won't reopen, And talking about that, I was supposed to be in D.C. this week, lobbying as president of County Executives of America with Congress and Senate, and we had meetings set up, but now we're trying to do it via Zoom. Very important for the relief package they got coming out to Joe Biden, President-elect Joe Biden, the top Democratic Congress leaders in the bipartisan COVID relief package yesterday is $908 billion. It's not the $2.2 trillion, but I'll take $908 billion, because what's in there, $300 more a month for people that have got laid off of this and now that are running out of unemployment. A bailout just not for the airline industry, but for people that work Broadway and for our arts and entertainment and our stage handlers, the people that don't have a check coming in, that can't pay for their health care. So there's so much relief in there. better than nothing. So to Nancy Pelosi and Chuck Schumer and to Mitch McConnell, please put your differences aside and get this done for the people of this country. I don't want to hear about politics. I don't want to hear about I don't care. Give a crap if you're a Republican, Democrat, conservative, working family, socialist. Get the job done for the people, because that's what matters. We need relief now. We need help now. And it means $160 billion to the state of New York, which is going to help the governor continue to do the good work that he's doing day in and day out. But we can't do it if they keep fighting over party lines and party affiliations. And listen, it's not perfect. It's not the perfect package. But I guess sometimes I've been taught in this job, something's better than nothing. And when you're looking at our SNAP program, our HEAT program, all our programs going through the roof, so to speak, this month alone, because people needed assistance, people needing housing. It's just the beginning. And I don't, listen, it's time for Christmas and holidays, and I want people to be happy. The light is there at the end of the tunnel. But please help us get there. Please. And reach out to all your Congress members and Chuck Schumer, our senator, our great senator, is doing a great job, and Senator Gillibrand and Paul Tonko and all of them, and just say, please get this package done for the people of New York State and for the people of this nation. So to wrap it up, I want to remind people to get tested. Whitney Young's available. I named the sites at the TU, but you can call Whitney Young at 518-465-4771. UAlbany, as always, 1-888-364-3065. CVS, Albany Med, I could go through it. Priority One, our good partners with Priority One in Gilliland. Again, we pay for it through Whitney Young. New York State pays it through UAlbany, so if you don't have insurance, don't worry about it. It shouldn't be an issue. And to all the partners out there, go to our website, albanycounty.com, and you can see the wait times and all that. Yes, we are checking it, and it's, some of the numbers are on time, some of them aren't. It's just people are trying to get the rapid test more than anything else, so be patient. As always, we have mental health support available 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. The 211 with United Way and the New York State hotline, as always. Please be safe and stay healthy. And any questions?
We heard from a viewer who has an elderly loved one in a nursing home. They don't feel comfortable giving them the vaccine right away. Do you think, or what is your thought, if there's a large number of people in nursing homes who don't take the vaccine, do you think that visitation won't be allowed or certain restrictions will be put in place because they're choosing not to get the vaccine?
So, that remains to be seen. Obviously, it's very important that people are compliant with availability and uptake of vaccine. I will say that, for those who have elderly relatives in nursing homes, please watch what happens when the vaccine starts to roll out, because it's not going to be piloted on elderly people, and that was what some people are concerned about. It is going to be given to the people that take care of people at the same time. So we're giving it to our highest risk of illness and death, as well as our highest risk of exposure, because the essential workers that are hospital workers, doctors and nurses, frontline individuals that are taking this shot are going to be doing this to protect your elderly relatives. And, the vaccine has been vetted. I think as it becomes available, we're going to hopefully see a lot of people that will help influence the uptick of behavior around, or uptick of compliance with COVID vaccination. It has been researched, it has been vetted, it is something that has been studied, and it is certainly a better alternative than the regret you may feel if you choose not to vaccinate or choose not to be compliant with vaccine and then go on to lose that family member. So I think that, I would more, in response to that, work on education, for people around the protection and the protective effects of vaccine. There are certainly a large amount of vaccine hesitant people, but we've never faced a public health crisis like this before. The magnitude of this, the seriousness of this, the risk of what happens, particularly to elderly individuals. And there are elderly individuals who get COVID and recover, but unfortunately there's no guarantee, and they're at a significantly high risk of more illness and death than the rest of the population. So I think that educational efforts will be very helpful in the coming days and weeks. Seeing first responders and hospital workers be vaccinated hopefully will help with people's comfort level of getting vaccine. And hopefully they'll educate themselves, as we urge people to do, to get the best information that they can to protect themselves and their families. And I'll say as well, we mention flu vaccine every day, that it's important to get your flu shot. Don't wait to get your flu shot. When you get your flu shot, it takes 2 weeks for you to develop antibodies. So don't assume if you get a flu shot, you walk out of the pharmacy or your doctor's office protected. It takes time. With the COVID vaccine, it is looking like that'll require 2 vaccinations that will be 21 days apart. And it'll be the same thing. After a first shot, people are not going to be immediately protected. They won't have full protection, which looks like it's going to be significant in the 95% range until after the second shot.
And actually, to follow up on that, do you think it would be then up to the nursing home to decide if they want to restrict people from coming in if the general public hasn't been vaccinated yet? It would be the nursing home's decision to restrict any sort of visitors?
So I think that the decisions that are being made are based on illness within the nursing home, not compliance with the vaccine. I'm not aware that there will be any change in policy, but obviously that'll be something that'll be discussed at the state and federal level.
My question is about rapid testing. I know there's a huge demand for it, but we've also seen that it's only 75% accurate. Are you concerned that more and more people are seeking out that type of test and that it may give them a false sense of security and potentially lead to more spread?
Yes. So, for rapid testing is a great tool if, for example, you were exposed or consider that you might have been at risk and you're asymptomatic and you want to rule out that you might have been infected. If you are symptomatic and you receive a negative rapid test, you should follow it up with a PCR test. So we are recommending PCR testing to those individuals that are experiencing any symptoms whatsoever. That is the test that you should be utilizing to give you a level of comfort about whether or not you are infected.
And I've also heard from viewers who are wondering how we're able to determine that small gatherings are the most likely cause of spread when we have so many people without a clear source of infection. What would you tell them?
So I think that data is being pulled at the state level and looked at very closely from that perspective. When we, ask people the questions that we ask them in case investigation, we get an idea of what their exposures could have been in the last couple of weeks, and that data all gets filtered into the state system, and they have aggregated that and looked very closely at that. So I believe that that is where that is coming from. I know it's not well received. I know it's not what people want to hear, but this is data that's been replicated nationally, and we're hearing nationally that it is these small get-togethers where people let their guards down and take their masks off in close proximity that can be the genesis of spread.
Any other questions?
With the 100 or so cases that you got where there was no contract tracing, do you ever hear from them about why they would even get tested in the first place if they weren't going to cooperate with contract tracing?
So I'm not sure what you're referring to, cases that have no contact tracing.
The clear source of infection.
Oh, the clear source of infection.
Yeah,
okay.
I apologize.
No, that's fine.
Got you covered.
So, people don't always know where they got COVID, and if clear source of infection means, okay, if you're going to ask me what I did in the last 2 weeks, I might be able to tell you that I was in the grocery store. I might be able to tell you that I visited a family member. I didn't, but someone might be able to tell you that. I might be able to tell you that I was in my work environment. But I could not tell you from that somebody was sick in any of those environments. So in those situations, we have evidence of where people were, and we have their history, but we don't have a clear source of infection. So in all those cases, that would kind of go into a database, and then it could be pooled at a larger level to determine what are the common denominators that we're seeing, and that's how they look at the data.
Only one question today for Dr. Whalen. You did review this earlier this year, but could you go over again the difference between a standard hospitalization and the ICU admissions and potential intubations?
When you want me to go over, do you mean what happens from a clinical perspective, or what
How much more severe is an ICU admission as opposed to a regular hospital?
Sure. So, to get into the hospital, you have to be pretty sick in the first place. So, you'd have to have some documented thing that couldn't be managed at home, whether it's your oxygen level is low, whether it's inability to manage something at home, whether you need some form of medication that's either intravenous or, has to be hands-on. So, hospitalizations in and of themselves do reflect severity of illness. If you are hospitalized, no matter what your age, it indicates that there is a definite need for that. Going into the ICU really is a need for critical care. So that means that you're in a situation where there are several things that are going on that could turn one way or the other. So whether it's from a cardiac standpoint, that you need to have cardiac monitoring around the clock, whether it is that you are having problems with your blood pressure that are either up or down that need to be monitored, and intensive therapy may need to be administered, or it's whether your respiratory status is such that you might need to be intubated. These aren't the exclusive reasons for going into the ICU. It could be multi-system problems. People go into multi-organ failure when they are very ill and close to death, and that would need to be taken care of in an ICU. It is just the intensity of care that's required. So when people are in the ICU, we know that it's a next level of severity of illness. The most serious illness really are taken care of in the ICU.
Any other? There you go.
I know you said you have a control room meeting later, but with hospitalizations on the rise and surge upon surge concerns, and people seemingly not fully reaching, I guess, what you're expecting after the Thanksgiving holiday, what are you hearing from the hospitals in the area about staffing and available beds, just with some of those new metrics that you said you're going to get direction on soon?
Dr. Venditti talked to our control room the last time, and he really put out a lot of guidance about opening meds, availability bed. You can stop elective surgeries like the governor did before. That's going to free up a lot of beds. And they feel right now they have the capacity to address the issues that are in front of us. So I have to leave it to the hospitals to indicate to us what they can handle and what they can't. And right now they seem to be handling everything that's coming their way, and thank God. And they feel going into the next few weeks they can handle it. But Dr. Whalen would know better.
No, I don't have any additional information on the hospitals.
No other questions? So I do want to say thank you. Please be safe. That's what I love about Albany County. We are going to get through this. The light's at the end of the tunnel, and we're strong. So please just do the right thing, and we'll get through this and get the vaccine out, and it will be a better day down the road. So thank you.